in time. So we'd like to thank you very much for taking the time to be with us this morning. And thank you for joining us at our 8th annual South Carolina Telehealth Summit, but actually our very first virtual summit. So thanks for being here this morning.
Yeah, so great to join you. As we were talking earlier, I've got a real soft spot in my heart and appreciation for South Carolina. I lived there for a year working for a judge, and so really welcomed the chance to join you all at this virtual event. And obviously, at the start, just want to express my thanks to all of the healthcare heroes that have just done unbelievable work in unprecedented circumstances through COVID. And I'm glad the FCC has been able to play a little bit of a role to help support you all, but really grateful and appreciative of all that America's healthcare heroes do.
Well, and like you and I were talking about earlier, I'd like to say that when COVID hit South Carolina, I really feel like our healthcare providers were prepared broadband-wise to implement telehealth on the spur of the moment. A lot had already been doing telehealth, but some had not. And so they were prepared and ready to start that transition. And so I want to thank you for that. So the first question is actually, how has COVID-19 impacted the work of your agency?
It's really amazing. So, as COVID hit this country, as sort of lockdowns and stay-at-home orders rolled out across the nation, really in an instant, Americans moved their lives onto the internet. Work rather than, driving our kids to school, we were engaged in distance learning from home. People were working from home and starting increasingly to access telehealth from home. So that sudden shift to the internet resulted in a sudden spike in internet usage. We saw around the country about 20 to 30% increase in internet traffic. And that doesn't sound like a lot in the abstract, but another way to think about it is we saw the levels of traffic, from one day to the next spike in a way that carriers, internet providers, didn't anticipate seeing that level of increase for another 2 years. So really overnight, we sort of accelerated by 2 years the level of internet traffic, and America's networks held up exceptionally well. And other countries around the world weren't so lucky. They had a lot more difficulty with lag time and slowdowns of their internet. In Europe, they asked video streaming providers like Netflix and YouTube to degrade the quality of their service to prevent the continent's networks from becoming overwhelmed. So at the FCC, we really sprung into action and supported the internet providers to make sure Americans could stay connected. We added some additional funding where necessary. We provided waivers of different rules to make sure people could stay connected. And we launched a Keep Americans Connected pledge to make sure that no one was going to be cut off due to the financial distress caused by COVID. So we really sprung into action from that perspective to make sure that the networks stay up, because of course, if they don't, we don't have telehealth at that point.
That's right. And I will also tell you, and this is not part of my script, but with the schools moving to a virtual environment during COVID, a lot of our service providers were actually providing free and/or reduced services if kids were at home. And I thought that was just a great way for them to step in and help out with the issue. Another story that's not part of my script is when we moved home in a virtual environment and my son from college moved home, we had never had that much internet activity going on at one time. So we would have 2 laptops running. And my internet service was not, and we also had Netflix running because my other son was home. And so we did not have enough internet. And so we learned that we had to increase that internet access. And I think a lot of people learned that during COVID-19. So my next question is, how do we begin to close the digital divide for our rural and underserved communities? And one of the things that I'd like for you to touch on is in my community of Bamberg, which is a small 16,000 folks community in the lower part of the state, when our kids moved home, almost 70% of them did not have internet access. And so they were the teachers were physically having to put packets together. Parents were having to pick them up, drop them off in 2 weeks. And so our state has done a lot to try to help with that transition. But in your mind, how do we begin to close this digital divide? Because it is a lot different between an urban area and a rural area.
Yeah, this is the most important aspect of the work that we do at the FCC. It's our top priority is to close the digital divide. And we're attacking that challenge from a number of different perspectives. First, to give you an update on where we stand, over the last couple of years, we actually have made really good progress in accelerating the closing of that digital divide. So since about the end of 2016, we've narrowed the digital divide by roughly 36%, which is actually a substantial amount of progress. So we're heading in the right direction. Internet speeds for people that are connected are up. Competition, so having choice of more than one internet provider for high-speed service has increased pretty significantly as well. And 5G services, or this next generation of high-speed wireless, is now rolling out across the country. And we have a commitment now from one nationwide provider, T-Mobile, to build out 5G to 99% of the U.S. population. So the reason we've been making this progress recently is trying to get the right regulatory framework in place in Washington that's going to incentivize the massive amount of investment that's needed to build out internet infrastructure. If you're looking, for instance, at building a mile of fiber, that can cost around $30,000 to $50,000. And if you think about some parts of this country that have one or two people per mile, that's a significant investment to recover. And so we have something called the Universal Service Fund at the FCC, the USF. It's about a $10 billion a year fund that we are increasingly orienting to support the build out of internet infrastructure in places where it hasn't been up till now. In fact, we're just going to be launching later this month an auction for something around $17 billion over 10 years to sort of identify and further support the build out of internet where there isn't any today. So we're making really good progress. If the progress we're making is a town over or a home over from where someone lives, it doesn't feel like we are. But when you step back and look at the data, we're really marching on the right course here. We just got to keep it up. And what we've done really is modernizing permitting, modernizing infrastructure rules, freeing up more spectrum. There was a lot of red tape that was just driving up the cost of building and slowing down where it was being built to. So since we've modernized a lot of those rules, we're seeing some good results.
So let me ask you another question. When we talk about that last mile cost, and I think that's a lot of reason why a lot of homes in these rural areas are not connected, because it is so expensive to connect 4 or 5 homes that might be located in one section. We have recently learned that there are about 130,000 people in South Carolina that participate in the Lifeline program. And for those that don't know, the Lifeline program is an essential program that provides subsidies to low-income households. And it is typically only about 20%, I think, of who we believe is eligible. What do you see communities and states doing to actually optimize the Lifeline program? And I think a lot of it is our homeowners aren't educated about it. What kind of efforts have you seen that we might could do here in South Carolina?
Yeah, Lifeline is a really important program. That's part of what the broader fund I was talking about with the Universal Service Fund. So Lifeline is to make sure that low-income individuals do have some form of access. And you're right. So far, we aren't seeing full subscription to that program. So there's more people that are eligible for the program than have been subscribing to it. We've tried to take some steps at the FCC, including waiving certain rules and taking other steps during COVID to make sure that people can get on or stay on the Lifeline program. But I think it's right to focus on that and how that can be used either generally or for accessing telehealth.
I think that's one thing in South Carolina that we need to do a little bit more studying on, and we hope to look into that and try to educate our homeowners a little bit more about that. So another thing that happened during COVID is we've learned about a partnership between the FCC, USDA, and Health and Human Services. Could you tell us a little bit more about that and what we can see hopefully as a result of that partnership?
Yeah, so if you step back, we've been active at the FCC on supporting telehealth since probably the early 2000s. And principally the work that we did was to support through funding the build out of high-speed connections to brick and mortar hospitals, healthcare facilities, similar institutions. That work has been producing really phenomenal results, and we're going to continue that effort. But one of the things that I saw when I got out of DC and traveled a bit and met with healthcare providers was I noticed there's this new trend in telehealth towards what I refer to as connected care. But the idea there is that, rather than, leaving a brick and mortar facility and having your access to high tech care drop to zero in many cases, A lot of people can receive care right on their smartphone, tablet, or computer. And I was in the Mississippi Delta and met a woman, Miss Annie, who had diabetes. And she noticed the first sign of diabetes when she woke up one morning with blurred vision, and she wasn't seeing much progress or improvement with traditional care methods. But the local clinic there sent her home with an iPad and a Bluetooth connected blood glucose monitor. And every morning she'd prick her finger and it would send her A1C number to her iPad, and she'd get instant feedback about what to do that day. Eat this, don't eat this, exercise this way. And she saw dramatic improvement in her care. And so I thought, rather than having the FCC just support connections to facilities, why don't we see if we can support this new trend? And the way I describe it to people is to really think of it as the healthcare equivalent of shifting from Blockbuster Video to Netflix. So you don't have to go physically to a place all the time to get care. You can have it delivered right to you, whether you're in your home or on the road. And the interesting thing is it's not just replicating the type of care you get in a hospital. It's even better, right? Because you have this continuous monitoring. So you can keep people on the straight and narrow before a health condition gets to the point where they're in the emergency room. And so that results in significant savings to the healthcare system, but obviously significant health outcomes and improvements for people that are in there. So we started the work to support that new trend in connected care. And our work with USDA and HHS is all part of this initiative to make sure that we are fully coordinated as we do this. Because again, we're sort of the internet people at the FCC, we're not the healthcare people. So there's limits about our expertise. There's limits about regulatory changes we can do. And so by partnering with these other federal health agencies and agencies focused on rural communities, we can bring to bear all the right federal resources to make sure that we are all fully oriented to support this new trend. And that's what our agreement with USDA and HHS does. Because look, I mean, as you, I'm sure, know, if you look at rural communities, there's a lot of factors that tend to cluster together. It tends to be lower income than densely populated communities. It tends to have poor health outcomes, and it tends to have less access to internet. So when you look at the three of those things that cluster together, bringing these agencies together can help address that.
Well, the USDA has the Reconnect Fund that I'm sure you're fairly familiar with. And that, I think we've been given maybe 3 or 4 of those Reconnect funds within the last year in South Carolina. And hopefully that will help expand some of that broadband. But so you talked a little bit about telehealth, and I know that the FCC sort of maybe went out of their comfort zone a little bit during COVID, and we did the $200 million telehealth program, which I think actually funded telehealth programs, I believe, in every state across the country. Could you tell us a little bit about that? And is there going to be an opportunity to have that type of funding available again, or do you believe that was just a one-time funding opportunity?
Yeah, so when we look back at the work that we started towards this connected care initiative, the mustard seed, the idea coming from that trip to the Mississippi Delta, and I've traveled around the country, met with people, including veterans that there was a Navy vet that I met online, James, and he used to have like a long drive in California to the local VA. And it was a hard drive, and he had a health condition, so it made it more difficult. But now he's got a connection right in his home. He can do virtual visits with his healthcare providers, or you see a lot of this with mental and behavioral health counseling. I was on the Pine Ridge Indian Reservation, which is right along the border of South Dakota and Nebraska. It's a long drive to get to Sioux Falls or Rapid City, where you could see a sort of a really expert mental health care provider. But now you've got these video visits where they can do it. So we think this is the future, and this is what we are working to support. Obviously, when COVID hit, we had no idea that our work to support healthcare at a distance would become even more important with the social distancing needed for COVID, because we don't want, particularly early on, people unnecessarily going to healthcare facilities. So right when COVID hit, Congress passed the CARES Act. The CARES Act included $200 million for the FCC, and we used that funding to immediately stand up all of the initiatives that we've been working on. And so that's where we had a lot of funding go out the door. And I've had the chance to travel around the country myself now and meet with recipients. I met with them in Nevada, Michigan, Ohio. I was just in Florida a week or so ago, hearing how they've put that funding to use. It's really pretty dramatic. I mean, I've been with healthcare providers that, went from seeing 95 patients remotely a month to over 22,000 visits. I mean, we just saw a massive increase in uptake in telehealth, and they were able to do that in these cases with this FCC funding. To your question, this will not be the last that the FCC does on this. The particular program, the $200 million one, may be in the sense that required an appropriation from Congress. And with that appropriated funding, we could actually fund more things like devices. Our organic or our existing authority is more limited to internet connections. But we do have a new $100 million program that is going to be starting up this fall. That's going to be very similar to the one we just went through, except it's going to be funding fewer things because, again, without the appropriation from Congress, there's more limits on the actual thing we can fund, but we can still fund connections and things that are sufficiently close to connections. So I wanted to make sure to get that out there to everybody that there will be a new $100 million connected care initiative. We haven't opened the window for applications yet, but everyone should obviously keep a close eye on that, particularly ones that successfully went through the last funding round.
And that's the Connected Care pilot program that you're talking about, right? I think
Correct,
the notice came out a couple of weeks ago, and I know in South Carolina, we are in the process of notifying all of our broadband consortium members. So I think that's a great program, and I'm interested to see how that goes. So you talked a little bit about telehealth, and I know that Congress did a tremendous job in loosening the reimbursement regulations around telehealth. I know that the FCC, a lot of your programs have been set up to fund telehealth services. So what do you see as the future of telehealth, and kind of what are you hearing in the DC area from your other commissioners, from members of Congress? Do you think the reimbursement is here to stay? Do you think telehealth is no longer a thing of the future, but a thing of today? Do you have any thoughts on that?
Yeah, I think one of the things that we saw with COVID is it really got, to your point, this tipping point of people really relying on telehealth. And that required a couple things. One, it just required individual consumers to become more comfortable with it. I think we've made a lot of progress given the uptake in telehealth. And our regulations were a bit behind. So if you look at what HHS did and Medicare and Medicaid Services Center, CMS, they moved very quickly to modernize their regulations. We had a lot of rules that, held back reimbursement. There were licensing issues, service across state lines, requirements that you see people in person. And a lot of those regulations were very quickly modernized by HHS, and sort of kudos to them. So I think going forward, the plan is to maintain those the flexibility that we've seen through COVID so that telehealth can remain and that we see the same levels of service that we're seeing now. My vision for the FCC is I think this new $100 million program, our prior $200 million one, is part of that effort to shift everyone and orient the whole system around telehealth. Personally, my vision is, after this FCC program, I'd like to see the healthcare system itself, healthcare providers, insurers, cover the cost of these telehealth services, because they're the ones that are really going to realize the savings when you don't have so many hospital readmissions, when you don't have people ending up in the emergency room, which is the highest cost portion of the healthcare system. So I think right now we're at this tipping point. I would hope that the system itself picks up these costs rather than having the FCC or Congress necessarily providing funding, because obviously that just distributes the cost, including among people that aren't seeing the benefits. So long term, I'd love for the system itself to step up and absorb a lot more of these costs.
So you just used the word a few minutes ago, flexibility. And I know that many of the FCC programs, the E-rate program, the Healthcare Connect Fund program, which is the one that funds the healthcare providers, the Lifeline, they all have very strict guidelines and regulations about who is eligible and the type of funding. What type of flexibility, or is there any flexibility that the FCC has when it comes to broadband disparities?
So there's a lot that we're doing to address that disparity or sort of get at the digital divide, as we talked about. And we do have a lot of tools at our disposal. Of course, one is funding. That's this universal service program that we are orienting to support, build out. Spectrum is important, making sure that providers have access to the airwaves that are needed to provide service and connect people. And we've been pushing more spectrum out there than ever before. In fact, I think as a country now, we we lead the world in the amount of spectrum that we've freed up, particularly over the last 2 or 3 years. We also have to get the regulatory environment right to incentivize providers to build out. I think on the wireless side alone, mobile carriers invested something like, I may not have the exact number, but $29 billion in their networks last year. I mean, that led the world. It was the most investment we've seen in the last 3 or 4 years. So that's the path it's going to take. Some funding around the edges to support build where it's not economic for the private sector, but otherwise creating the environment for the private sector to let it rip. And when we see these build outs like 5G, for instance, we have a responsibility to make sure that these new high-speed networks aren't something that only the lucky few that live or choose to live in densely populated areas. So it's great that New York and San Francisco has 5G, but that's not the finish line. I think a better measure of the progress we're making is that today 5G is live in Sioux Falls, South Dakota. A week or two ago, I was in Defiance County, Ohio, and saw 5G connecting consumers there. So I think that's a far better measure of where we are as a country and the progress we're making. But we are far from raising the mission accomplished flag. There's still too many Americans that don't have a high-speed connection.
So I'm glad to hear you say that there's 5G in Sioux Falls, because when you have that discussion about 5G with providers and, leaders in your state, their first thought is, 5G is going to be easily adopted by the urban areas, but it's going to take a long time to get to our rural areas. And folks are anticipating, at least 5 years out before we actually have 5G available in most of our rural areas. Do you think it's going to take that long, or do you think it's going to be a quicker adoption and really going to be one of the ways that we close the gap in those rural areas?
Yeah, the 5G builds that we're seeing in this country are really accelerating. And if you look back 2015, 2016, people were sort of prematurely writing the U.S. off. They thought that China was going to dominate on 5G. I think there was a Deloitte study that said we were about to see a 5G tsunami from China and that the U.S. wouldn't be able to catch up. But by reorienting our regulations, allowing the private sector to invest, we've now leapfrogged our global competitors. So we're in good shape with respect to 5G builds. It's far ahead of schedule where a lot of people would have put it not too long ago. And we are starting to see it move into some of the rural areas. And again, we've got this commitment from T-Mobile within the next couple of years to build out 5G to cover 99% of the U.S. population. So that's going to be the finish line. It's getting 5G out there for everybody, and we're well on the way to getting there already.
So I have another question for you along with the various FCC programs. As we try to educate healthcare providers and sometimes even households about the Healthcare Connect Fund, the Lifeline program, there's a lot of question and concern. And one of the first questions is, well, how long lasting are these programs going to be? Am I going to get a subsidy for a year and then the program is going to run out of money? What do you see as the future of the FCC programs? Because what we tell folks is that universal service fee tax will continue to be there to fund these programs. And are we right about that? Do you think the future is bright for your various programs?
Yeah, these programs are pretty stable at this point. So if you look at one of the funding mechanisms that we talked about earlier, we have this $20 billion fund that we're going to start auctioning off the first at least $17 billion of probably later this month. That's for a commitment over a 10-year period. So that provides a lot of the certainty needed for stability in the fund. There is increasingly a little bit of discussion of moving some of this universal service fund from effectively a line item fee on people's telephone bills to something that will be appropriated by Congress. And I'm certainly open to seeing how those conversations go. But we've had these programs for quite a long time. They've proven to be durable, stable programs. So I think they're ones that people can continue to rely on. And I think the $100 million one that we're talking about for the Connected Care initiative would be providing that funding over a 3-year period. And we would use that 3-year period to sort of pull in a lot of data about how telehealth is being used. And so I think that 3-year period would be a stable time frame for the purpose of some of the telehealth connections we're looking at.
So with the Healthcare Connect Fund a couple of years ago, for those that don't know, there is a cap for that program. And we hit that cap. And then the FCC came up with sort of a formulary for a way to increase that cap. Do you think that there's going to be a future formula for increasing that cap? Because I think the program is growing. I know in South Carolina we have seen it grow tremendously. And are we going to hit that cap again, or do you think as we try to promote these programs across the country and more people are going to be applying and participating, that the FCC is going to work with USAC to work on those caps and make sure that we have funds available?
Yeah, it's a good question. So to your point, we had this fund, and if we're talking about the same one, I think it was roughly 500 million, maybe a little bit less a year for this particular funding mechanism. And to your point, we had undersubscription in that program for years and years. We never hit the cap. And all of a sudden we saw a spike and we sort of bumped our head against the cap. And we took a couple of steps to address that. One is we increased the budget, as you noted. And then recently we put some more money into it as well in light of COVID. And we've adopted some other reforms to provide some more certainty on the front end so that people aren't necessarily depending on getting funding or thinking funding's there, and then on the back end finding out actually we hit the cap. So I think with the additional funding, with some of the reforms designed to provide more certainty on the front end, I don't anticipate that we'll be in the same situation that we were 2 years ago when folks thought we sort of unexpectedly hit the cap.
Well, Commissioner Carr, you've talked about a lot of things today, and you've mentioned the Connected Care pilot program a couple of times. And if I understand correctly, that is actually if eligible healthcare providers are going to be providing services in the homes to their patients, then this fund will actually pay for connectivity in those patient homes. Is that correct?
That's right. Yeah, this one is principally focused on, for instance, you could have a healthcare provider that says, I've got 50 or 100 patients with diabetes. I want to sort of set them up with these devices in the home to monitor their care. This part of the FCC funding would principally be about the connection between those devices and the healthcare facility. Again, it's different than the CARES Act funding, which would have covered the devices themselves. This one's much more focused on the actual connection. But we've been able to sort of look as expansively as allowed by our authority to see, are there other things sort of sufficiently close to the connection that we might be able to cover? And I don't remember off the top of my head all the technical devices or routers or hardware that may or may not software be included. But yeah, I would encourage people to look at the information we've provided and identify as many of your costs in providing that remote care that would potentially be eligible under this program, which again is a bit narrower in terms of what it covers from CARES Act. But again, the difference there just being that our authority using USF money as opposed to appropriated money just covers slightly fewer things.
Well, we are excited. Hopefully that more information on that, I think you said, is coming out in the fall. And so for the folks that are watching, we will make sure that we get that information out to our consortium. And we have taken up your time, Commissioner Carr, and we thank you so much. I know things are hectic, and we appreciate the time that you've given us. And the next time you come to South Carolina, if you give us a call, we'd love to catch up with you and take you to a few of our areas that have really benefited from some of your programs.
Absolutely, yeah, would love to meet with some of the healthcare providers. As long as there's barbecue involved somewhere as well, then you've got yourself a deal.
Well, listen, in South Carolina, if you come on a Thursday, Friday, Saturday, that's when the barbecue restaurants are open. So make sure you're here on a Thursday afternoon.
Perfect, I appreciate it. Good to connect with you all. Really enjoyed it.
Well, we did too, and thank you so much. And we hope you continue to do more great work that you've been doing lately. Thank you so much.
Thanks.
Bye-bye.